Hello, Rachelle Schultz from Winona Health here again to talk about another topic of great importance and interest, I think, to the community. So I am sure by now everybody has heard yesterday we did have our first two positive test results in the community. And so the question becomes, well, what does that mean? What does it mean now that we have some positive confirmations as opposed to before we had all of that? So I wanted to address that in a couple of different fronts. Primarily, it doesn't mean anything more than what we were doing before. It's just that we now have validation for what we believe was already in our community. We have been operating under the assumption for probably the last couple of weeks that the way this virus has been kind of moving across the country, that we quite likely had cases here in our community. We were just not able to identify them because of the lack of the ability to test and identify, where that might be or when they came to the community and all of that. So we now know. We now have this validation. We know it's in our community. And what we know about this virus is that it also spreads quite quickly. So from our standpoint, we have continued with all of our planning and our preparation. Nothing has changed as far as any of that goes. The positive cases that were reported were in one of our local nursing homes, and we have been, right hand in hand with them, helping them out. We've been in conversation with all of our area facilities as well to make sure that we're all kind of on the same page and we're all helping and supporting each other. I think it's really important that we all keep in mind, it didn't matter like where it shows up first. This is likely to show up across our entire community, and so we really need to support each other. We need to support staff and families, help kind of keep our anxiety levels down, because this is a time that we all need each other and we all need to sort of be in this together. So as we're doing all of our planning here, as we're talking with our other area facilities, I just have to tell you, this has been another kind of phenomenal experience of everybody really working together and supporting each other in their needs and just keeping everybody's chin up in a tough time as we work through what is this virus really all about, for our community. You might have heard earlier today, about 2 hours ago, Governor Walz also had another press conference and sort of elevated, if you will, the request to have people stay at home, be a little bit more aggressive with those actions to, protect yourself, protect others. Again, really trying to provide more time for preparedness or readiness in terms of hospitals. If you happen to watch that press conference, he also was showing a model that they've been looking at about when we might expect the peak of this virus to hit, what kind of numbers we might be looking at. And I thought it was of great interest because we've been doing that model here also for Winona specifically and for our service area. And I think all of our numbers line up, specific to our community, very similar to what he, was sharing that the data analysts have come up with at the University of Minnesota. So those, as we model those numbers for our community and what that looks like, what we need to prepare for, the timeline that we're looking at, and extending that timeline, this is something that's not going to be done in another couple of weeks. We're talking about, 11 weeks and 14 weeks actually till we hit the peaks, of ICU demand and also the peak of the virus, in our community. And that doesn't mean it stops at that peak. There's still kind of what trails off after that. So, we're looking at this as being really in for the long haul here and being prepared for sort of the ramp up, sort of the heavy work that will happen in that middle of the peak, and then kind of like the downside after that. So remains a lot more time here for all of us to sort of work through all of these issues. And again, I want to just assure the community that our physicians, our nurses, our clinicians, our support staff, everybody is really highly engaged in this readiness planning and current state work to make sure that we can take care of folks that are going to be coming into our facilities. So I want to assure you of that. Thank you all for your support, and let's just keep supporting each other all across the community. And with that, I just want to say thank you again.